Good morning, sir. I am Asujan Weska from BSN1A, and I am here to demonstrate to you how to properly assess deep tendon reflexes. So we have 5 deep tendon reflexes. We have the biceps, triceps, brachioradialis, patellar, and achilles reflex. So in this demo, I will be using a reflex hammer. We will grade a deep tendon reflex response of the client as 0, 1 plus, 2 plus, 3 plus, and 4 plus, being 2 plus as average, expected response, or the normal response. So first is we have to assess for the biceps reflex. So the patient arm should be flexed slightly, and then the palm facing upward. Then we have to hold the arm with our thumb in the antecubital space. Then we have to strike our thumb with the reflex hammer. So the arm will be flexed slightly. The next one is we have to assess for the tricep reflex. So the patient arm should be flexed at 90 degree, and then we have to support the arm with our hand, and then we have to strike the arm just above the elbow between the epicondyle. And as we strike, the arm should be extend at the elbow. One is we have to assess for the brachioradialis reflex. So the patient arm should be flexed slightly and then resting on the lap with the palm facing downward. Then we have to strike the forearm 2 inches above the wrist. Then as we strike, the palm turn upward as the forearm rotates laterally. Next is how to properly assess for the patellar reflex. The patient legs dangling, we have to place our one hand on the thigh. Then we have to strike the leg just below the kneecap. So as we strike, the leg extend at the knee. So next is we have to assess for the Achilles tendon reflex. So with the patient's foot in slight dorsiflexion, we have to strike the back of the ankle just above the heel. Then as we strike, the foot should plantar flex.